Now, another important thing to remember when it comes to the pelvic girdle or the hip bones is that there is quite a bit of a difference in the pelvic bones, in these hip bones, in males and in females. Because the female pelvis is designed for childbearing, and therefore it is much different as compared to the male pelvis. Now, the key features or the key differences are that in case of males, the pelvis is much more vertical and taller, but in women, the this pelvic girdle is much smaller, as in the height is much less, but it is much wider. The male bones are, of course, much more dense as compared to the female bones, which are less dense, and so the pelvis is lighter and less dense. Now, after that, in case of the male pelvis, the acetabulum is much larger, and in case of females, the acetabulum is smaller. In addition to that, when it comes to the obturator foramen here, in case of males, the obturator foramen is oval in shape, and in case of females, it is more round, more triangular, sorry. And then when it comes to this angle here, this is known as the pubic angle or the pubic arch, right? So this is the angle which is formed between the two ischiopubic rami of the two sides. So this angle is much narrower in case of a male pelvis and is much wider in case of a female pelvis. Now, when it comes to injuries of the hip bone, it comprises of less than 3% of lower limb injuries. And whenever there's a fracture of the hip bone, it is usually called a pelvic fracture. And when we talk about a hip fracture, commonly, it usually refers to a fracture of the femoral head, neck, or the trochanters. So when we talk about hip bone fractures, they're known as pelvic fractures. Now, in case of pelvic fractures, the most common are the avulsion fractures of the hip bone, and they usually occur due to sports that require sudden acceleration or deceleration. And avulsion fractures usually occur at sites where ligaments, muscle ligaments are attached, and they usually pull the bone out as well. So the common sites for these avulsion fractures are the anterior superior iliac spine, the anterior inferior iliac spine, the ischial tuberosity, as well as the ischiopubic ramus.